Okay, so I'm with Kelsey Rail and Kristine Godsill with Sparq PT. We've been honored to be working with Sparq since I think February of 23, I think is when things got started. So it's been about almost 2 years, coming up to 2 years, and just love how you guys have grown, and you're setting your own rules as a practice and being successful. From our perspective, you're doing fantastically. So my first question, why the name Sparq with a Q?
Oh, go for it.
Okay. I think we got really good advice as we were planning to open, that when we were thinking about names, that to take into consideration what we wanted people to like feel when they heard the name. And so we landed on a lot of different words, and Sparq kind of stuck with us. And then just like funnily of like things that you have to take into consideration when you're opening your own business, like websites and domains.
Availability of names.
Yes. So part of it was to what was available. And when we were parsing out of what was available and then like what we liked for font wise, we really loved the mirroring of the P and the Q. And so it kind of all married together, and it hasn't been so confusing for people. So it's good.
I think too, we wanted that like spark of something starting, and like you're starting your recovery and it's like you're igniting a fire type thing. So totally. I did have one patient who finally asked me how to pronounce it, and they were like, "Oh, I've been saying Sparq," and I was like, "Wow,
that's cool.
So fancy." Yeah.
Just Sparq.
That's very fancy.
Yes, yeah.
You're giving us a lot of credit. We are not that fancy.
Yes.
Well,
yeah.
It's a great name and it's a great logo, as we can see on your shirts. And it really, you clearly put a lot of thought into that, and it worked out. So great decision. And you were in Colorado. And so tell me, what prompted you guys to want to do your own thing, to get out there and just be completely independent?
I think we both had worked in environments where we were tired of kind of that like PT mill setting, right? Where you're seeing people on the half hour every 20 minutes, and you don't get the time you want with the patients that you have. And then we both have specialty niches where that's even further exacerbated. I work with concussion and Kristine does pelvic floor, and it's really hard to take the time you need with those clients in 20-30 minutes. So I think we were both a little just fed up with that process and that environment. And we met at a time where we're both really feeling that and kind of clicked and decided like, well, considered it in the past, it sounds a lot more fun to do with a buddy too than by yourself. So kind of went from there, and now we're here, which is cool.
Yeah, I think that's such a great move to do it with someone, because as I'm sure many of the owners who are watching this can attest, it's tough going on your own with no one to bounce things off. And when you have those bad days with no one to talk through those things with. So
we do plenty of that.
Yeah, we all need that.
Yes.
I think too, like we both have strengths. For Kristine, it's more marketing. For me, it's more of those like financial things. And so to divide those tasks too, and like do the ones you enjoy, it's nice to have a buddy in that respect for sure as well.
Yeah, makes a lot of sense. Very good. Okay, so you started in early 23 and decided to sort of bring it all in-house there. What made you think about the idea of outsourcing your billing then, as opposed to doing it yourselves? Because oftentimes when you get started, the volume isn't crazy, and you think, okay, maybe I can do some of this myself. What was your thought process there?
I think we had a lot of foresight, enough of like trial and error, but then too of knowing that like us building wasn't going to be, it wasn't going to be forever. And so playing on those like strengths and weaknesses that we do have, we just didn't want to have to stress about it, and something that we wanted to be really intentional about, because when we were planning Sparq and what we wanted out of it and how people felt when they walked in the door to where our time was going, billing wasn't fitting in that regard, and in a way that we didn't want it to detract of who we were offering services to either. With our specialties here in Colorado, especially, we felt like with pelvic floor and concussion vestibular, that Medicare and Medicaid didn't really have a lot of options. And so we knew when we opened, we wanted to give that as an option, but also knew that like
Mhm.
that could have been taken a lot out of our time of like
Mhm.
seeing patients and whatnot. And so if we could outsource it and make it more seamless and have somebody a part of
Yeah.
our team, then absolutely.
Yeah.
And so thankfully we got referred to you guys.
Yeah.
Yeah.
I think even from like a just technicality and legality standpoint, there's a lot of pitfalls when it comes to insurance. And obviously, like PT Pilot is, there are people who spend their whole time and expertise on that. So I think we, again, had enough foresight to be like, it's naive for me to think I'm going to be an expert in all
Yeah.
things Medicare and Medicaid. And that's not what I care about. Like, I care about treating people. So finding that right fit that can take care of that for us, and that I don't have to stress about any of that stuff because I know it's being handled the way it's supposed to.
Totally. Yeah.
That's great. Yeah, we feel the same way. You know, I'm a PT owner originally, and it was clear to me that as a PT, if we can spend our time mainly on treating, on marketing, and on growing our team, those are the three things that I think that we as PTs are so good at. And then, you know, there's other things that maybe online marketing and billing and HR stuff that, yeah, CPA work that maybe we should be delegating to other experts in the field. So yeah, I think it's a tough thing to delegate this kind of thing to, because you know it's it's one more thing that there's an outlay for, but it does allow you to then invest your time in the things that really grow your business. And that's been clear in your business. You guys have grown so well and so successfully, and I know you're thrilled with how the practice is moving forward.
For sure.
What kind of patients do you see at Sparq?
So we're all outpatient, right? So people are past those rehab stages that you get in hospital or in a rehab facility. And then we do kind of full spectrum orthopedic care, which is what I always call like PT bread and butter. Like that's what people think of when they think of PT. But then we do have those specialty niches. So I see concussion related to like car accidents, sports concussions, those sorts of things. And then all things in the realm of like vestibular and dizziness. Which has multitudes of where they're originating or what's happening to them, but that's kind of my piece.
Yeah. And then I specialize in pelvic floor, and started out in pediatrics. So I do have some kiddos that come on my caseload, whether it's from like skiing accidents or if they are having pelvic floor dysfunction. But we do joke with some of our patients that we like treat the whole family. So from any age and gender of what they're kind of up against, we probably have a fit for it. Like the amount of times that somebody's just like, do you guys do this? And we're like, actually, yeah. But sometimes it's like, well, that's Kelsey. So you can talk to her about it.
Yes.
You know,
so lots of passing off sometimes.
Yeah.
And I think we pride ourselves on our specialties. There's a lot of those bigger corporate clinics that have their list of services that's a mile long and say they treat concussions and say they treat pelvic floor. But when it comes down to it, it's really, they're more of an orthopedic place. So for us, our specialties shine, but like most PTs, we did start in orthopedics. So we've got good background.
Yeah, you have that background too.
Yeah.
So it sounds like you really have a great niche there in your area, that you take care of those patients better than the competition by the sounds of things. But yet you can take care of, their relatives for whatever they need as well.
Right. Yeah. And word of mouth is probably one of our biggest referral places too. So
great. Yeah. It's a great practice idea. It's great to be able to differentiate yourself from the competition.
Yeah.
Well, yeah. We're going to ask the question, how has your experience been with PT Pilot Billing? Has it, we want the good and the bad and the challenges and all the stuff.
I would say overall excellent. We did work with a different kind of billing option before, and in comparison, PT Pilot is like light years ahead of the other person we worked with. And I think in terms of like bad, it's the stuff that's not necessarily in your guys' control either. It's just like the waiting periods with credentialing with insurances and those sorts of things.
Yeah.
But also knowing that, again, I'm not wasting my time on it or checking on it. So even that, I'm like, I'm happy to wait. I know someone's taking care of it.
Yeah. Even the bad is masked with a lot of good, because the open communication that we have with PT Pilot has been so seamless. So even if things are either getting pushed back or with credentialing or anything like that, I feel like it's always an open door policy of like checking in on things, or we're getting updates that we haven't even asked for. And we're like, oh yeah, thanks so much. Totally forgot about that.
Yeah.
So it's been very seamless and felt like just adding another part of our team onto Sparq. It's been incredible.
Yeah.
That's so great to hear. Thank you. I was just talking with Connor before this call Just a
We
check.
love Connor.
Yeah.
He's
Can't say
great. He's great. But I was
I
thinking,
love being like, I'm gonna email this to Connor and he's just gonna do it. I don't know if he actually should, but he takes care of everything for
oh,
us.
he
Yeah.
loves you guys. He never complains. But I was like, Connor, some of these claims, these UHC claims, he goes, don't worry, we've got the documentation that we're going to get them in. Once they get credentialed, it'll all go through.
Yes.
Yeah, he's on it.
Fantastic.
for sure.
The amount of times I'm like, oh, thank God I can just ask Connor to do this for me because it's billing related and I don't have the time for it. And I think especially in contrasting to who we worked with before, the communication and the like how quick and precise and timely everything is fantastic. In fact, sometimes Connor's like, I send him an email late on a Friday and you guys are 2 hours ahead of us. And I'm like, he'll get to this on Monday. And he's like, I'm out of the office, but I'll do it first thing Monday. And I'm like, that's so nice. Like he didn't, but I know that it's there and that it's going to be taken care of. So yeah, he's fantastic. And so is everybody we communicate with at PT Pilot.
Well, that's great. Thank you so much for sharing. That's exciting to me. Well, I'm excited to hear what's next for you guys. Any big plans for the next 12 months? Are we're going to keep on this nice growth trajectory that you've been having? Is it kind of the plan? Maintain your quality?
I think so. Yeah. Always maintaining quality, and for us maintaining work-life balance too. We are a small practice. It's just the two of us, which is also why we smartly thought like we need someone to do this piece for us. We do, I think, want to keep small, but that may look different as we continue to grow too, because of course there's only so much capacity on our schedules, being mindful of work-life balance. So
for sure.
Open opportunity, but we'll see kind of how we continue to grow over the next year too.
Yeah.
I'm sure you're going to find yourself in a position where you're getting more and more patients that want you, and you're going to have to find a way to maybe, to manage that, whether it's bringing someone on or create waiting lists is even okay. But
we would love to have
good problem.
We're building towards that. It's a good problem for sure.
Yeah.
Great.
Yeah.
Well, ladies, thank you so much for your time. I really appreciate the input and appreciate you as clients so much for, almost 2 years now. You've been fantastic. And we certainly want to make sure that if there's anything we can do for you, please, we'll make sure we take care of it. And if for some reason Connor doesn't get an email back to you on a Friday, you can beat me up. I'll get on to it.
All right. Fair enough. We'll do that.
Yeah. Awesome.
Okay.